Bismillahirrahmanirrahim. Allahu, 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 Allah. Allahu, 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 Allah. Allahumma salli wa sallim wa Nabina Muhammad alayhi salam. Salatan tadubu wa tuda ilay mamara layali wa tuda tawam. Allah, 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 Allah. Allahumma salli ala Sayyidina Muhammad. Bismillahirrahmanirrahim. My name is Fatima Burhan. I'm the wife of Sheikh Omar, and I'm going to speak to you today about hygiene, issues of hygiene and cleanliness as they relate to hijama and hijama practice. Since this is an introductory course, I am not going to go deeply into the matters of the physical hygiene, but that's something that you will you'll receive a deeper and more in-depth training at the time. If you're chosen as a ijaaza candidate and you come to the physical location and training, then you will receive instruction in blood safety, bloodborne diseases, infection control, those kind of things. But as for this introductory course, we'll talk on things briefly, and we're going to talk about physical cleanliness, spiritual cleanliness, and a few other things today. And everything we do, we have to have a balance, and this being a spiritual endeavor that we're embarking on in hijama, we're always looking to balance the spiritual and the physical. I'm sure that Sheikh Omar spoke on the subject of spiritual cleanliness and the need to protect yourself on a spiritual level, and so I'm not going to cover on all of that in this course today, but just to say that, like a bird, a bird with one wing can't fly. So you have the spiritual elements of cleanliness, and then you have the physical elements, which are also required. Since we're looking specifically for those qualified to act as hijamis, we are specifically looking at your spiritual acumen more than your physical techniques and or qualifications. However, that said, whenever you're dealing with human beings and their blood products, it is necessary to understand the physical nature of the practice and the risks involved. These points generally here in this introductory course, but understand that if you're chosen for an ijaaza track, you will attend a physical course in which you will receive proper training, clean and sterile technique, as well as safety issues surrounding the handling of blood and body fluids. We will talk about those things today also, though. There are spiritual teachers in the past who have, suggested that the spiritual protection is sufficient, and perhaps it may be, but we have an obligation as Muslims, as practitioners, we have an obligation to also protect ourselves and protect the people we're working with from any harm. And since we are aware of and know that there is harm that can come from exposure to blood and body fluids, then we have an obligation to protect ourselves from that. We're not permitted to be careless with those things. Even within our religious practice, we're not permitted to be careless with anything that can cause harm. So we are going to definitely touch on, well, that's the focus, is on the matter of physical hygiene in this course today, this class today. Um, I guess I want to also to speak about, just briefly, I know that Sheikh Omar has spoken on it, but I want to speak briefly on the distinction between hijama and cupping. That hijama is a religious practice, not a medical one. That's something that you have to make clear whenever you're working with, patients come in. You make clear that you are a hijama practitioner, that the hijama is a spiritual practice, a religious practice, and is not a medical practice, and that you're not a medical practitioner. We're not training you to be a medical practitioner. Some of you may be. Some of you who take this and who get ijaaza to be hijama practitioners may actually have medical background and may have medical training. I myself am a registered nurse. I have medical training, but when I perform hijama, I don't present myself as an RN, as a registered nurse performing a medical procedure. I make it clear to the people on whom I'm doing hijama that this is a religious practice, that it is the sunnah of the Prophet Muhammad ﷺ, and that I am doing it under that authority, with that permission. That I am not presenting this as a medical practice, and as far as I know, it's not something that's even covered under my practice as a registered nurse, and so I have to make that very clear. And it's rather important that you make that distinction clear, that you have that distinction within yourself, and that you make it clear to your clients. I guess the first, I guess actually where you begin in making that distinction is determining that you yourself are fit to be a hijam, or that that's actually what you're looking for, that you are looking to fulfill the sunnah of Prophet Muhammad ﷺ, as opposed to looking for something that you want to do within your practice and something that you want to include to your business for a business reason. If you're looking to incorporate this into a therapy practice and the purpose is for business, then perhaps you're looking in the wrong place. If you're looking to promote the sunnah of Prophet Muhammad ﷺ and spiritual healing, the spiritual healing qualities that come with that, then this is, you're going in the right direction. The ancient artisan therapy of cupping had its roots before Islam, long before Islam. And if that's what you're looking to do, then that's not what we're preparing you for. The hijama is specifically rooted in the Prophet, in the medicine of the Prophet Muhammad ﷺ, and in outlining certain practices, Prophet Muhammad ﷺ approved of and incorporated elements of the ancient Oriental practice of cupping. I'm going to give you another example of the incorporation of something that existed pre-Islam and then was incorporated into the culture, the Islamic culture and the Islamic practice of health and wellness. And I know that many of you are going to bristle at the thought, but it's something I want to discuss. It's something I want to talk about, and I think as a woman it's something that it's an issue that I'd like to explore more broadly, and maybe even in another context. And that is the example of female circumcision. That is something that Prophet Muhammad ﷺ was asked about circumcision of females, and this is another example also of where Muslims get this very confused. Muslims in many parts of the Arab world and Africa say that because this permission was given, that they have carte blanche. They can perform it in all of its horrible ways that they do it, and that's just not true. Because what Prophet Muhammad ﷺ did was he narrowed it and he defined it. He gave them permission when he was asked about female circumcision. He gave permission to those who were from a culture where if the girl was not circumcised, she would be ostracized from the community. And so it would ruin her life if her family did not say that she was a circumcised girl. He gave permission in that instance, in that where the culture, he said, if you must. And so that means if you have a reason, you must, because your culture is going to demand it. If you must, then take only a little. And a demonstration was like pulling the skin and cutting the skin, not the actual clitoris. So it was very defined. It was absolutely defined how it was allowed. What was allowed was only this small piece of this culture or this pre-Islamic practice. Many Muslims don't even know that. Muslims in Africa and in Egypt, in some parts of the Arab world, they're still performing this horrific thing to girls, and they're doing it at the age of 4, 5, 6 years old, which is terribly traumatic, and it's completely anti-Islamic. It is completely against Islam to do this. Many people won't speak of it because they say, "Oh, Prophet Muhammad sallallahu alaihi wasallam, he allowed it." Nobody defines what that means, and so in the same way that some of what the ancient art of cupping therapy, Prophet Muhammad sallallahu alaihi wasallam prescribed hijama for his people and for Islam as a practice, as a religious practice. He prescribed a certain way of using cupping for the benefit of the whole being, the whole body. It benefits the whole body when you use it in the way that it was prescribed. And the way it was prescribed was to be done, it's more of a preventative kind of way, and it's a cleaning. It's simple. It's, the 7 points on the body are enough. And to be done with moderation. There's moderation involved. I don't even understand all the things that are done in the Chinese cupping therapy world. But I know that I've seen some horror stories and some things that absolutely are not part of our religious practice, and they're certainly not what you are being told or taught how to do in this hijama course. Now, why did I go off on that in regard to cleaning? I don't know, except to say that in defining what it is that you're being prepared for, you have a full understanding that what you are being prepared for in hijama, in this hijama course, and any hijama course that you take with Sheikh Omar and myself, is that you are being prepared to promote the sunnah of Prophet Muhammad sallallahu alaihi wasallam. You are not being prepared to be a cupping therapist, not through this course, not through us. We are preparing you to perform and to keep alive and to promote the sunnah of Prophet Muhammad sallallahu alaihi wasallam. And with that in mind, there are some aspects of physical cleanliness which are related to your spiritual cleanliness. Sheikh Omar has spoken about the matters of spiritual cleanliness and and some of the work that's done on a spiritual level with regards to ruqyah and these kind of things. But that's not what I'm going to go over again. What I want to talk about is the need for preparing your body for spiritual procedure. And that's something that Muslims will understand clearly. But those of you who are not Muslim, who are looking into this and wondering about this and wanting to understand and be a part of hijama, then you need to also understand ritual purification procedure, things that we do as Muslims. We use water. Water is a cleansing. Cleanses the body, but also cleanses from spiritual dirtiness, spiritual contamination, so to speak. We use water in a couple of different ritual procedures. Ablution? Ablution, is that the right word in English? I believe so. Ablution is the act of ritual purification with water. There's the first one is a ghusl. That's Arabic word ghusl, which is basically a shower or a full submersion into a body of water. And that is with the intention to cleanse yourself from spiritual impurity or from darkness, from, negative energy, basically. So when you get into the shower and you get into the full body waters, which is submerging in a tub or a lake or a river, you submerge yourself completely, head to toe, and you say with the intention is to cleanse yourself from spiritual darkness, spiritual harm, or dirtiness, in the name of God, in the name of Allah. Bismillah ar-Rahman ar-Rahim. You're doing this in the name of the Creator, because that you need to make that connection with your Creator before you embark on this process. So that is the basics of, and if you want to be Muslim or you are Muslim and you don't know how to make a ghusl, then you should get with someone in your Islamic community and learn how to make the ghusl properly and with all of the ins and outs of it. I'm not giving that here. What I'm giving here is just an understanding of what a ghusl is. It's a full submersion in water from head to toe with the intention to clean yourself from spiritual dirtiness and also physical dirtiness, but in order to be away from the dirty spirits that the dark spirits like the dirtiness of our body, so we clean ourselves. And you should do that before you embark on hijama. So you're having, people are coming for hijama that day. Then in the morning when you get up, you should do your prayer, do your meditation, or do a ghusl, do your prayer and your meditation. And then prepare yourself for the people that are coming for the hijama. And then right when they arrive, you should also then do what we call wudu. And wudu is something else that Muslims do, which you can do to get that ritual purification without, submerging yourself completely in the water. And that is to wash the hands in a certain way. The hands, the face, the feet, basically the head. And again, if you want to learn, if you're Muslim and you don't know how to make wudu, or if you're not Muslim and you want to understand it better, then you should, if you come to the intensive, you'll certainly learn it. If you come to the hijama intensive, you'll certainly learn to make wudu and learn to have a ghusl. But you can also go to Mostini Mosque and learn how to do those things if you want to understand that in depth. That's not what this course is about. Again, it's about just giving you the basics. So your guests come, the people come that are going to get the hijama from you, and you should you should do another basic cleansing of yourself, which includes your face, your hands, your feet, and with, again, the intention of purifying yourself from anything, any darkness, any spiritual badness that's come since the time of your last purification until now. Anything that has occurred that has caused negative energy to come to you. And you should do that right before you begin the procedure. So as far as physically preparing your body in a spiritual way, those are the things. Before you begin the procedure, you should have the ghusl in the morning, do your prayers and your meditation, whatever that entails for you. But everyone who's on this kind of path should have morning prayers and meditation, whether you're Muslim or otherwise. You should have that kind of a practice, otherwise you're really not suited for hijama. So you wake up in the morning, do your prayers, do your meditation, or do your ghusl, your prayers and your meditation. In that order. You should do the ghusl first so that you really are able to connect with your prayers and your meditation that you do. And then prepare yourself, whatever, if you're going to have a small breakfast or something, because sometimes it can be quite, for me, if I'm going to be doing the hijama, I go ahead and have a small something in the morning before I begin. So I do the ghusl, the prayers, the meditation, have a small breakfast and coffee usually, but just something to, and then receive your guests, get your wudu, or get your, purification, your small, or we call it the smaller purification for those who aren't Muslim who don't understand the wudu, right before you begin. and then begin your procedure. So that leads us then to the next point, which is the physical aspects of cleanliness. Come to the next point, which is the physical aspect of doing the hijama. You begin your procedure. You should always have maybe a blue pad. You know, for all those who are medical people, you'll understand a blue pad. If you're not a medical person, it's blue pads are clean. They're not sterile. And maybe right now I'll just give you a quick definition or a distinction between clean and sterile. Clean, something which is clean, medically speaking, is something like a dish has been washed in the sink with some soap and it's sitting there clean. Something which is sterile is more than that. It's that dish having been boiled for 10 minutes and being free. When something is sterile, it's said to be free of any microorganisms, anything even small, any bacterias, anything. It's completely clean of those things. It's something that something is sterile is something that you could put into your body. It would not cause an infection as long as it's sterile. Something which is clean is not sterile. It has been washed with soap, but it's also been touched with hands, or it's been exposed to the air for a long period of time, and it's no longer, it's not, if you expose something which is sterile to open air for a specific period of time in the medical, speak, we don't have to define this exactly, but if you expose it for a period of time, then it becomes no longer sterile. Or if you leave it and it's been touched, even if you just barely touch it, you just like that. So you've got something and you're connecting two sterile things. If you accidentally touch that with your finger, even briefly like that, you've broken the sterility of the thing. It's no longer sterile. It may still be clean, but it's not sterile. So a blue pad is basically something which is clean. So you could have just a towel which is clean. I prefer to use things that are you can throw away, so like a blue pad. It's disposable. If you don't have disposable and you are using things which are clean, that's fine, but make sure it's freshly cleaned. It's coming out of the dryer, it's been folded up, and then when you unfold it, fold it out so that the part that was in is laying, Personally, I just prefer that you use disposable things which have never been used for anyone else, for anything. So for purposes of this class, let's go with the blue pad. So you lay out your blue pad, and on your blue pad, you're going to organize your stuff. And you're going to have your little cup of, say, alcohol, which is where you're going to put if you're using razor blades, you're going to put them in that. And again, you understand that you're making them clean. You're not making them sterile. Even putting them into a cleaning solution does not make them sterile. It makes them only clean. What is preferred to use for cutting is a lancet, which is in a sterile package, so that when you open that package, the actual tip, the actual razor part of that tip is sterile. It's always preferred when you're going to break the skin that you use something sterile, such as when you get an injection in the doctor's office. They don't take the needle out and throw it on the table and leave it just lying about and then stick it in your body. That thing's got a cap on it and it's come fresh out of the package. They pull it open and they, stick you with that. And that needle, the actual tip of that needle is sterile. And it's always preferred because you have less chance of getting an infection. And obviously we can't make the skin itself sterile. But at least what we're putting into it can be sterile. So it's preferred. Some people do use razor blades. If you're going to use a razor blade that you bought from the store, you need to disinfect it and clean it in a solution, cleaning solution such as alcohol or kerosene. Some people use kerosene to clean those. It actually works as well or better than alcohol to clean the actual razor that you're going to use. So let's see, you lay out your lancet, which is going to be in a package, or you're going to take your razor blade and put it into the solution. The other thing is that when you're beginning to put the when you're putting the cups on with the fire. This is something a lot of people, they go and they put their gloves on. It's very hard to do the fire with the gloves on because you can catch your gloves on fire. And it's not necessary at this point to have gloves on because you're not breaking the skin yet. You clean the skin and you're going to just stick the cup on there. So in sticking the cup, when you put the fire and stick the cup, you don't need to put the gloves on at that point. You don't need to put your gloves on until the time when you are about to cut the skin. Just before you cut the skin, go ahead and put your gloves on. Pull the cups off, cut the skin. This is the part that's tricky, is that you do want to keep your gloves on when you have to reapply the cups because you could get contaminated. In applying those cups, the blood can be running down. It's best if you get the cup on before it runs in order to get a good suction, but you just never know. And we're not talking about full technique here. What we're talking about is safety from blood. So anytime there's any possibility that the blood is going to get on your skin, then you need to have gloves on. So that's a technique you're going to have to perfect. And it might be a little tricky at first, is being able to reapply the cup with the glove on, because you have to put the fire and get the cup back on. But you do need to keep the gloves on at that point. And those, for me, once I put those on, and you're going to let that sit for a while, okay, there's always a possibility that at that point, when you reapplied the cup, there's a possibility that you got some blood on that glove. Say on your thumb here, maybe when you reapply the cup like this, you may have gotten a little blood on the edge, which is why you're wearing the glove. Okay, so what you don't want to do, and there's so many people, even medical people do this, and I hate it when I see this. As an RN, I worked in infection control, so I'm a little bit, picky about this, which is why I'm teaching this class. So you went to stick the cup on. You get a little bit of blood on your thumb, which is covered by gloves, so you're protected, right? But after the fact, then if you keep those gloves on because you're waiting for when you're going to pull the cups off, because you're going to need gloves on at that time, then anything you touch in your house, anything you touch, anywhere, is going to get possibly contaminated. So as soon as you get the cups reapplied, you need to pull those gloves off. You pull the gloves off by coming here and turning them. And you turn inside out, all that technique you'll be taught at the time. But you basically turn the glove inside out. You pull it down, pull it off this way, so that any contamination that's on your fingers is inside, and you're contained inside the glove. And you throw that in the garbage. Then, because you're going to wait maybe 15 minutes while the blood's coming out of the person into the cup, you're going to be waiting. And so you're going to be waiting, but you still need to take those gloves off, throw them out, and then actually right then you need to put new gloves on. You need to put new gloves on while you're sitting there waiting, but those gloves need to be clean. In case you reach for something, or you do something, or you scratch your ear, or whatever, you need to have those clean gloves. Those gloves need to be clean while you're waiting. The reason you need to don new gloves while those are bleeding and while those are finishing is because if they fall off, you're going to have to catch them. And in catching them, if the person is bleeding a lot, and catching them, if you don't have your gloves on, then you're going to contaminate yourself. So while you're sitting there waiting, you do need to have the gloves on, but you need to have changed your gloves. So as a recap, let's recap. Recap, when you put the cups on to start, you don't need gloves on. You put the cups on, you let the welt come up, you pop the cup off, and before you cut, you put on a glove. Right? And then you put the new cup on. After you put your new cups on, You take those gloves off, throw them away, and put on new gloves so that those gloves are clean. And those gloves are what you sit there with those gloves on while you wait and while the bleeding is happening. And yes, you're not touching anything at that time, but you could need to touch. You could need to catch a cup when it falls. It falls off, you need to catch it. If you need to catch it, you don't need to be worrying about, oh my God, I'm going to get blood on myself. You just need to catch it. And in so doing, you could contaminate yourself if you don't have on your gloves. So you sit there and you wait, and then when it's time to pull the cups off, you have your gloves on and you're ready to go. You get your paper towel, hold it underneath to catch any blood that might come down, and you pop the cup off. When you're the other precaution that I think that you probably want to take, and we'll go into this more, in depth as necessary for those who come and need training. Anybody who hasn't had any medical training will have a full-on course, and you'll have to demonstrate your ability to handle all these situations and to not contaminate yourself or someone else. For anyone who has medical training and you can demonstrate that you understand all these things, you won't have to take necessarily that kind of, that in-depth class that you'll have to take otherwise. The other point is that whenever you're popping things off and you're doing things and there's always the possibility that you can splatter blood up onto your face. And so there's a need for at least some goggles or some kind of eye, protection. And like I said, we'll go more into this. We'll go much deeper in depth on the risks and the techniques and and you'll have to demonstrate that you can do these things. So don't get all nervous that I just gave you a lot of stuff that you can't remember, because you'll remember it by the time you're allowed to do it. I really think that's all I'm going to speak on when it comes to the physical aspects of infection control, because there are so many other things. Well, I can say that, that there are certain things that need to be done with regards to disposing of lancets and things that have blood on them. You really need to have a container that, like in a hospital, they have what's called the sharps container. You need to have a container where you put those things, like a coffee can, a jar, something where it's a solid thing that nobody can accidentally run up against and stick themselves with. And then those need to be taken to an incinerator to be incinerated at certain intervals. If you're doing this in any kind of a facility where you have other medical practice and whatever, you'll have those containers. But for those of you who are doing it at home and those of you who are doing it strictly as hijama practice, as we are, you need to just remember all these things and make sure that you properly take care of things so that you don't put anybody at risk. Like anybody in your community or your trash people, or you need to be taking proper care of razor blades and lancets. Anything that's had blood on it needs to be incinerated. So if you've got to figure out where to take that, then that's what you do. I think that's about it that I'm going to cover in this introductory course. And again, my name is Fatima Burhan. I'm a wife of Sheikh Omar, and my ijaaza to do hijama is through Omar and through Sheikh Mohammed Adil of Cyprus. He's our teacher, he's our sheikh, and he is who we get our ijaaza from. Originally, Sheikh Omar, I'm sure he's told you, ijaaza was through Sheikh Nazim, who was the sheikh prior to Sheikh Mohammed. And if you come to the hijama intensives, then I look forward to seeing you and meeting you all. So y'all have a good day.